Hello, this video is a small portion of a complete comprehensive video. If you'd like to see this complete comprehensive case and many other complete comprehensive cases, click on the link in the description below. Painless and profound local anesthesia, that's so important. That is a practice enhancer. If a patient knows that you can give painless and profound local anesthesia, that will be a practice builder. I can't tell you how many patients I see, and at the new patient interview they say, my dentist could never get me numb. Well, it's because they don't know how to do it. If you watch those videos, you will know how to give painless and profound local anesthesia so every tooth is as numb as that countertop. I end up extracting the first molar because there's so much decay. And then I end up doing endo on the second molar. I'm using the 330 carbide burr to cut through the metal. I use the coarse barrel diamond to cut through the porcelain, just old porcelain to metal crowns. This is why it's so important to do a comprehensive exam and a second formal consultation with the patient. You're talking about this, so she knows there's a high probability I may be extracting. There's so much decay underneath here. She knows I may be extracting that tooth and grafting it and coming back and placing an implant. We've talked about it ahead of time. Remember what I'm about to tell you. My granddad told me this, that if you explain something and talk about it ahead of time, it's a reason. If you're trying to explain it and talk about it after it's happened, it's an excuse. So we don't want to make excuses. We want everybody to know what is going to happen or what could happen prior to the appointment. Emotional energy has a dollar value. If you're having to explain to a patient that didn't know that a tooth might need endo or it might need to be extracted after you've done it, you just don't want to be in that situation. It's not comfortable. You know, they're wondering, did you mess something up, or is that really what happened? So if you talk about it ahead of time, it's a reason. If you're not talking about it till after the fact, that's an excuse. So I'm cutting this in two parts because I want to take it out in two pieces. Notice my rubber dam is still on. I use rubber dam many times for extraction. So you're going to cut all the way through the interproximal area and torque those two pieces and try to come as straight out as you can with the pieces. I hate taking out old brittle teeth. I was in a surgery fellowship for 2 years and have taken out lots of teeth, and I would hate to be doing that all day. I mean, oral surgeons earn their money. The thought of doing a full mouth extraction on a person with fully developed roots on those teeth doesn't sound good to me at all. Now, sometimes in a case like this, you may have just a little root tip that fractures off. Now, what do you not want to have happen? You don't want to damage the inferior alveolar nerve. So you may just take a PA and see how much of that root's left and cut it back with this round carbide burr. Just flatten it out. You just, because you would, if you went after that little tip, you're taking a chance on damaging the inferior alveolar nerve. So you want to know exactly how much root is there. And you don't want to cut to the tip of the root. You're going to leave some of the root. It looks like I got that one, but I wouldn't have minded leaving a little bit because I'm not going to damage an inferior alveolar nerve trying to be a hero going after that root. Now I've left some tiny little root tips in sockets that I've grafted and placed implants, and knock on wood, I've never had an issue that I'm aware of. Now in a perfect world, you want to get the tip out, but Mother Nature, you don't want a patient to have a permanently numb lip by damaging the inferior alveolar nerve. So I'd rather leave that little tip, just clean it real well, and I've never had a problem with that even when I placed an implant. I'm just cleaning up the socket and the tissue. This is a distal wedge, this is a mesial wedge. So in this case, she did not have good veins. I had to start the IV in her hand, as a matter of fact. And so I'm using only freeze-dried bone. Just packing that into the socket. Then I'm going to use a resorbable collagen membrane, Contour Adapt. I typically use Maxius or Biowas freeze-dried bone. And I'm going to contour this Contour Adapt collagen membrane. If you reflected the flap a little bit, you can tuck it under the edges of the flap. So in this case, I'm putting 2 collagen membranes just to have good coverage. Remember, the collagen membrane not only creates a flat surface, but it also keeps the soft tissue from growing into the sockets. You want the bone to have a head start on the soft tissue so that socket fills up with bone, not soft tissue. So the collagen membrane will last about 3 months, and that's enough to give the bone a head start on the soft tissue. Now, I don't try to get primary closure necessarily of the flap, which some people say you need to always try to get primary closure if you're grafting, unless you put a platelet-rich fibrin graft in the socket. I've done it this way for a long time, and to my knowledge have never had a problem. The reason I don't reflect way down into the unattached gingiva and cut releasing incisions is because I want to keep the blood supply from the soft tissue to the bone intact, because that has a lot to do with good healing. So I'd rather have not primary closure and have the flap attached to the bone and have that blood supply for healing of the graft than have primary closure, because to get primary closure, see, this is close to primary closure, but to get primary closure, I would have had to reflect way down into the vestibule, cut releasing incisions, and pull that flap over. And I'd rather not do that. I'd rather keep the attached gingiva and the unattached gingiva, non-keratinized gingiva, attached to the bone. That's the Dental Minute. These techniques work, and they work every time.
Are you feeling stuck? You know you have more to offer and you can elevate higher in your dentistry practice, but you just don't know how to do it? Well, great news. DentistryMasterclasses.com is here for you. At DentistryMasterclasses.com, Dr. Cutbirth is offering his greatest work and his best cases. Here's everything included when you subscribe to DentistryMasterclasses.com. You will get incredible comprehensive cases not seen in Dental Minute videos, an organized library of all the Dental Minute videos, and the Dentistry Masterclasses, comprehensive cases for study and reference. You will get before and after pictures of Dr. Cutbirth's fantastic restored cases. And guess what? All of this is $40 a month. That's right, $40 a month. This is an opportunity you cannot miss. Go to DentistryMasterclasses.com and subscribe today.